the stimulus plans, but the alternative of doing nothing, I think, would have been a disaster.
First of all, that remains to be seen. There are plenty of people who said no, and second of all, I think now in America we need people standing on principle and saying enough is enough.
Well, Doc, I guess what I would say, let's talk about the economy for a second. If 6 months ago or 9 months ago, and I'm not saying that the economy is back by any means and unemployment's way too high, but if you'd said to me in mid-March, we should take an economy at Labor Day where the stock market's up 50%, where banks were paying their TARP funds, and the housing market is at least stabilized, and we've had 7% increase in the last month, I'd say that's wildly optimistic. Now, you may say the TARP program or the stimulus plan had nothing to do with that. We can agree to disagree on that, but I think we are in better position than almost all of the economists would have predicted.
Senator, stimulus, we've spent less than 10%. How did that have any effect? If you're telling me we're on the right track, why are we going to spend the other 90%?
Well, part of this is because the stimulus is cumulative, and I think it's going to help spurring this. Matter of fact, I will grant you this, Doc. Only Democrats would be crazy enough to allow a $250 billion tax cut to be called a spending bill. And $250 billion of this stimulus was a tax cut. $250 billion went to the folks in Richmond to make sure they didn't have to make the same kind of cuts and have Virginia's budget look like California.
Senator,
$250 billion.
You know it was a couple of dollars a week per person. It's ridiculous. No one is doing anything with that. That's not stimulating anything.
Doc, let's at least argue with facts. We got $270 billion of tax cuts that came out of the stimulus. There were tax cuts to families. There were 5-year look back in terms of small businesses.
I know that, but
on losses. There were $8,000 tax credits. Doc, I read the bills I've
yes,
studied.
I know that. It added up to a few dollars a week per person.
Doc, you add up a few dollars a week. I know maybe for you and me, extra $1,000 a year isn't very much, but for an awful lot of Virginians who are working hard, an extra $1,000 a year, I think that's more than peanuts.
Senator, it's not that. It's that is not the stimulus you're talking about. If you're telling us that's going to change everything, it's not going to.
I'm not saying that is. I'm saying that when you've got an economic catastrophe that was created by lack of financial oversight, by a lot of excessive practices, again, on both sides, and a lot of people asleep at the switch, and you took actions that were, I didn't like taking, but the alternative of doing nothing, I think, would I have loved, if I was drawing up the stimulus, would I have done it differently? You betcha. But the alternative of saying, let's do nothing, I think our economy would be in dramatic...
Why wasn't the stimulus bigger? Why didn't we make it $2 trillion?
Because, Doc, when you're there trying to make these judgments, there is...
The number was arbitrary, we know, though.
You're absolutely right.
So why, if it was that successful, how are you saying that you don't want more? You should want to double it. If it was that, if Casper Clunkers was that successful, why don't we triple it?
I think what you did was you took emergency actions during the midst of an emergency, and then you need to get back to normal. Now, I don't think...
But you just set a precedent for any other emergency down the future that's open to any congressman or senator or president saying, well, here we are in emergency again. Anyways, we'll move on. I got a couple of other questions I got to ask you about.
Right.
Number one, are you going to put your family in the same health care plan that would be... if
yeah, I think congressmen and senators ought to have the same, ought to be... what's good for the goose is good for the gander. I think they ought to be part of whatever is offered as part of the health care options. Now, you got to understand, Doc, what I've got right now as a senator is I get a choice of private plans.
I know that. I understand that.
And we pay for it. And we pay for it.
I understand that. It's also pretty good coverage, number one.
What other people ought to get is they ought to get the same kind of choices that a senator gets.
I said, will you take what choices other people get? Whatever you pass, where you and your family...
I will take the same kind of choices. If I've got the same kind of choices that everybody else has got, I think you've hit a good point here, Doc. I think we ought to make sure that the choices that I get, that every Virginian ought to get those same kind of choices. That's one of the things that's crazy about our system right now, and why I think we need more competition in it. And what I hope is more private competition. But we've seen time and again insurance companies pull out of markets. We've seen insurance, and I don't think there's, I think it's too easy to demonize insurance companies. Nobody's got clean hands in this process. But I start again with the fact that
when you say clean hands, though, that's capitalism. That's what they're supposed to do. Go make money. They're insurance companies. So you're saying they're doing something wrong. They're making money.
If there is no provider in a marketplace, and you've got a system down in Miami that reimburses and has twice as high a health care cost as the system where I'm calling you from today in Roanoke, I think that shows something's kind of wacky. And that's not the free market that I believe that we need to get back to.
Anyway, it's capitalism. You were a businessman. Would you have said, well, you know what, I can't go ahead and spend this extra money because there's not enough competition. I can't try to make more money off it.
So you're saying no matter what the market bears in all circumstances, that ought to rule. So if, in other words, if there's no healthcare provider in a market, if I want to come in and the normal, doc charges $50 a visit and I want to charge $500 a visit because there's no other competition in that market, we ought to be able to say that's okay.
Yes, that's called capitalism. And what that will do is encourage somebody else to say, as long as there's not a bunch of government rules and regulations preventing me from doing so, I can do it cheaper. I'll undercut that guy and do it for $100. And somebody else will come in and say, I'll undercut it and do it for $50.
And you know what, Doc? What we've seen in the last 10 years is we've seen our healthcare costs in this country double. We've seen healthcare costs both in the private sector and the public sector. And I got to tell you, I'm not sure we're getting the kind of value that, that other countries are getting. I'm not sure.
Do you think we have the best healthcare system?
I think if you've got plenty of money, we've got the best healthcare system. If you are a middle-class Virginian and a middle-class American struggling, I'm not sure we do have the best healthcare system by any kind of measurement.
Senator, people come from all over the world to get their healthcare here.
That's right, because the people at the very top end come from all over the world to be able to pay the top dollar. But you don't see a middle-class person from some other country coming here to kind of go into our Medicare and Medicaid system. They don't see them coming over here and buying some private health insurance. If you can come in here and put cash on the table.
So what we'll do is dumb ours down, make ours less efficient.
No, I think what
less
we've got to do, I think this is not about dumbing ours down. This is about raising the overall bar and making our system more efficient and effective. I got to tell you, this is Econ 101 for me. I got a bunch of the other freshman senators to kind of weigh in and say, coverage is important here, but if we don't drive the cost curve down, we're up the creek here. And what I'm going to keep fighting for is how we drive this cost curve down. Because as a business guy, as somebody who's providing health insurance to my employees, I can't compete if I got to pay $3,000 to $5,000 more per employee. That is hurting America's competitive position.
Why are you giving them health insurance? You don't have to give your employees health insurance. You don't have to do that.
Well, I guess and again, Doc, this is an area where I think as a good employer, providing health insurance makes a lot of sense. I think if you're somebody, I guess, Doc, here's...
Yes, but you don't have to, is my point. You're using that as a false starting point to say, well, I have to whatever. Of course it is a false. It doesn't. It's not a right. It's not in the Constitution. You don't have to do those things.
Doc, if you're making $100,000 a year and you're 28 and you're one of these young invincibles and you choose not to have any kind of health care coverage and you can afford it, and then you get in an accident and you show up at the hospital and you're asking the state to pick up those costs.
No, the state shouldn't pick them up. That's the point.
But the state is picking up the costs.
But they shouldn't. That's the point.
Right.
Government gets us into this mess. They create this false premise by saying, well, because we went ahead and passed a rule that says we have to provide for those people, now we have to go ahead and mandate insurance coverage for everybody, create a bunch of wacky plans, because if we don't, those people that we said we're definitely going to cover will have to pay more for. It's ridiculous.
Doc,
it's circular logic. It doesn't make any sense.
Doc, what I guess you're advocating for is, and it's a bold position, I take it, that somebody who's been in an auto accident that doesn't have health insurance, you're going to turn them away at the emergency room door. I mean, the great thing about our country is you got to have that right. That's not my idea of what America's about.
So you do think it's all right. All right. One more quick question. Did you notice the billboards around Richmond, the ones that are asking you why you're not having town halls?
Well, Doc, I'm doing a telephone town hall this afternoon with 3,000 or 4,000 people probably on it. I think we're making 60,000 calls out on it. I've done a healthcare forum this afternoon. I've been talking about healthcare for 15 years. I started the Virginia Health.
Where have you been the last 2 weeks since Congress has been in recess?
Doc, I'm guilty. I took a family vacation and I took my daughter to college, and it's been a couple days.
Senator, I don't have a problem with you going on vacation. We all need to do those things, but Congress is the one right now telling us that we are in such dire straits. We got to wait a minute, hang on. That we have to slam through stimulus and TARP and health care now and cap and tax and all of this. That we have to nationalize banks and insurance companies and automakers. It's dire straits. We've got to do it now. And Doc, you're not out meeting the people wanting to know what they believe.
Doc, I know you haven't been in Virginia long, but I did.
No, don't even do that. Hold on, Senator. Hold on. That was insulting to me. I've been here 2 years, and when do I become a Virginian then?
I think you become a Virginian when you move here.
Yeah, so don't even throw out that I know you haven't been in there too long thing. That's ridiculous. That was insulting.
Maybe you didn't know, Doc, that I did close to 60 town halls when I was out talking about...
I'll tell you what, I'm here fighting every day for freedom for the people of Central Virginia, while you're there in Congress saying we got to slam this stuff through. In the last 2 weeks, you've been an absentee senator.